Honorable Minister Moses Jean-Baptiste, Minister of Health, Wellness, Elderly Affairs, Ms. Jenny Daniel, Permanent Secretary in the Ministry of Health, Wellness and Elderly Affairs, Dr. Sharon Belmar-George, Chief Medical Officer, Ms. Joanna M. Reynolds Atherton, Chairperson of the Board of Directors of the Millennium Heights Medical Complex, Dr. Dexter James, Chief Executive Officer of the Millennium Heights Medical Complex, other ministry and government officials, the management of the Millennium Heights Medical Complex, specially invited guests, friends, well-wishers, media, and our online audience. Good morning to you, and welcome to the commissioning of the secondary care medical facility here at the secondary care hospital here in Hospital Road.
It's a pleasure to welcome you to this official commissioning of the 12-bed ward of the new secondary care facility. It's not the commissioning of the entire facility today. We are truly appreciative of your efforts for gracing us with your presence here today. This is another milestone and cause for celebration for the Board of Directors, for the Ministry of Health, Wellness and Elderly Affairs, and the Government of St. Lucia. I reference another milestone because just 4 days ago, several of us here met to celebrate the commissioning of the oxygen generating plant, which is now in full operation at the Owen King European Hospital. Please note that in the coming months, there will be more events for celebration as we roll out other initiatives, both big and small, to the benefit of our nation's health sector. I know, for example, that I'll see you again very soon for the commissioning of the laundry facility at MHMC. Very often, we take these types of celebrations for granted, giving little thought to the players who work directly and indirectly behind the scenes to ensure that these milestones become a reality. So in that regard, I would like to recognize and extend a special welcome to some key players. And among those are our Minister, the Honorable Moses Jean-Baptiste, Minister responsible for Health, Wellness and Elderly Affairs, the CEO of the Millennium Heights Medical Complex and all his staff, every single one of them, the members of the board, Ms. Danielle, the Permanent Secretary in the Ministry of Health, the CMO, Dr. Sharon Belmar, and all other senior officials, all other officials for that matter, in the Ministry of Health, Wellness, and Elderly Affairs. As you will see from the program, there are several other speakers who will come to provide the background and the details of our journey, of our success story. So I will leave that part of the narrative to them. Once again, I extend a warm welcome to each and every one of you, and I thank you for coming to celebrate this milestone with us. Thank you.
In August 2022, following the gross reduction in the number of COVID-19 patients requiring treatment at the respiratory hospital, the Ministry of Health, Wellness and Elderly Affairs sought to examine and strategize towards the repurposing of the valuable infrastructure that we see on these premises here at the former Victoria Hospital. In consideration of this, the Cabinet of Ministers directed the repurposing of the former Victoria Hospital into the Castries Multipurpose Healthcare Facility. This facility is proposed as a 3-tier functional healthcare facility which will provide services within 3 significant components of the healthcare sector, namely the primary healthcare services through the establishment of the Castries Urban Polyclinic, the urgent healthcare services which are to be operationalized through the Castries Urban Polyclinic and run by the Ministry of Health, Wellness and Elderly Affairs, and the secondary care healthcare services in the form of the secondary care hospital operated by the Millennium Heights Medical Complex, and of course we witness the formal opening and commissioning today. Given the growth and expansion of the urban population within Castries and the overall northern districts of the island, we have seen a significant increase in the overall demand for health services within our facilities in the north. As a result, this has placed tremendous pressure on the Castries Wellness Center and the Millennium Heights Medical Complex, particularly the Owen King European Hospital, to provide adequate and quality services where required. In particular, the closure of the Cashries Wellness Center at 4:30 p.m., coupled with the limited capacity for diagnostic services, such as those offered through laboratory and radiology units, has created a situation where the emergency room of the OKEU is often oversubscribed, leading to lengthy wait times for services and a reduced capacity for the delivery of quality healthcare services. Let me just wait a minute. The establishment of the Cashries multipurpose healthcare facility is expected to alleviate some of the issues impacting healthcare by developing an effective urgent care component within the Cashries Herbal Polyclinic, which would operate with extended hours, and this will hopefully absorb the numbers of urgent but non-emergency patients who would normally have visited the emergency room at the OKEU. In order to accommodate this, the facility will be equipped with the capacity to conduct basic diagnostic tests that would improve the quality of services available. Secondly, the relocation of the Cashries Wellness Center to these premises here is expected to take place, of course, starting in January 2024, with the temporary accommodation of these services within the former emergency section of Victoria Hospital, and then later within the Francis Dolto building, again at Victoria Hospital. It is anticipated that the relocation of the primary healthcare services will enhance service delivery in a wholesome manner while safeguarding our staff and the clients whom we serve. And of course, thirdly, we have the secondary care hospital, which we are opening here today very proudly. And, it is intended to provide relief, particularly to the OKEU hospital, in terms of bed management and ensuring that persons have sufficient access to beds and healthcare services that would help to improve their health. Of course, today, this is a very proud moment for not just Millennium Heights Medical Complex, but overall the Ministry of Health, Wellness and Elderly Affairs, specifically because we have had a long history and tradition with Victoria Hospital. We saw the move of the Victoria Hospital into the Owen King European Union Hospital. And of course, we look forward to the end of the COVID-19 pandemic, which I keep asking Dr. Belma every day, is it over yet? And she cannot respond. But as we, transition out of this pandemic, we look forward to the repurposing of the buildings, which of course commences officially today. But those of us who have been part of the planning process at the Ministry of Health and the Millennium Heights Medical Complex know that this has been something which is almost about more than a year in making, with various consultations, site visits, technical officers, Dr. James and his team, Dr. Belma and the public health team at the Ministry of Health, the Deputy Permanent Secretary and everybody else, chipping in to provide the necessary support to take us to this point where we are today. I want to, of course, commend Dr. Belma. I know she's somebody who has very much been an advocate for this kind of collaboration and provision of services, particularly as it pertains to the improvement of the primary healthcare services provided at Cashries Wellness Center and the establishment of the urgent care facility. I know that Dr. James, Dr. Charles will feel a measure of relief as we gradually develop our section of this facility, and to ensure that there is a less of a pressure and overwhelming feeling faced by the staff at the Owen King European Hospital. So today I commend the team, I commend everyone. It's a proud moment for us all. I thank everyone for their input. We will commit towards communicating these new developments to the public to ensure that the services are used and accessed in an appropriate manner, and to ensure that they provide the relief and the healthcare services that are required so badly in the north of the island and, of course, nationally. So I thank you today for having us here, and we hope that everything works out well, and, thank you for coming with us.
A warm welcome to the commissioning of the Millennium Heights Medical Complex latest expansion of our real estate called the Millennium Heights Medical Complex Secondary Care Hospital. Today we gather for yet another momentous occasion to commission Phase 1 of the Millennium Heights Medical Complex Secondary Care Hospital. This commissioning was born out of a cabinet conclusion to repurpose the facilities of the former respiratory hospital in what will be known as the Castries Multipurpose Medical Facility. This facility will comprise an urgent center, the Castries Urban Polyclinic, both facilities to be developed and managed by the Ministry of Health, and the secondary care hospital to be developed and managed by the Millennium Heights Medical Complex. In the case of the latter facility development, the following facilities have been transferred to the complex. A building known as the Chest Wing, which comprises 12 beds. This building will continue to be used for managing the unlikely presentation of infectious cases or patients with communicable diseases. The inpatient wards, what was previously known as Ward 9, comprising 12 beds, Ward 5 comprising 7 beds, the old dietitian office comprising 4 beds, and the surgical unit comprising 8 beds, a total of 31 beds. Other buildings transferred include what is known as the pediatrics building and the old nursing home, both of which are currently being assessed by a competent expert for their structural integrity. Additionally, this new hospital will be supported with 2 fully equipped state-of-the-art operating theaters, 3 ICUs, and a footprint for a satellite laboratory dispensing services and imaging services for both routine X-ray and ultrasounds. So how did we get to this phase of development? In early February, when the decision was taken by the cabinet to establish a secondary care hospital, our board was required to manage this major change process, a change process that involved the staff transfer and transition from the former respiratory hospital and the remediation of inpatient wards. To accomplish these major tasks, several meetings were held with key stakeholders, which included staff who would be directly affected by the change process, staff of the former respiratory hospital, and I'm happy to report that by March 31st this year, 94 employees were onboarded with new MHMC employment contracts. This was a seamless transition that involved an aggressive recruitment process, several meetings with staff and their respective trade unions. As of today, all categories of staff participated in orientation and immersion training programs at the OKEUH to familiarize themselves with our corporate policies and service quality standards in various areas of operations. We have since installed an on-site management team which comprises an officer in charge, Mr. Jonathan Emmanuel, who is here with us today, and he is supported by senior nurses and managers and supervisors in various areas of support services, namely security services, food services operations, housekeeping, and patient transportation services. Since installation, I have been working with this team every Friday at 9 a.m. to work through any operational issues to service development, but predominantly to focus attention on repurposing the use of the former respiratory hospital, the as-is, to what we define as the to-be. What you will witness today in this Phase 1 commissioning is testimony to the long hours of hard work by this team and a consensus on shared vision of what this facility will become. A phased implementation to the development of this hospital was the only pragmatic approach to the development of this facility. The main activities in this Phase 1 development comprised the conduct of a comprehensive assessment of the plumbing and electrical infrastructure. This assessment was necessary to ensure that we remediate any defects in services and to assure ourselves of a safe environment to manage patients. There was the completion of remediation works toward 12 beds. These works included the construction of 2 bathrooms, including facilities for the physically challenged, resheeting of floors, repurposing of new space for pharmacy operations, remodeling of the nursing station, and installation of medication rooms. Ladies and gentlemen, construction works to remediate this facility commenced with the assessment of 3 tenderers who were identified selectively to bid for these works. And at the end of the assessment, Mr. Emerson Edward was awarded the contract as the lowest cost bidder at just about $213,000 EC dollars. The contract was signed in September 4th, and all works have been completed within 9 weeks. So what does this infrastructure mean to the OKUH? These facilities will complement services currently provided at the hospital. They will provide for additional beds to expand inpatient bed capacity, improve the flow of patients at our accident emergency department, sustain and improve the provision of elective surgery due to cancellations. The additional beds will provide for the continued management of care to patients described as low acuity and requiring minimal care intervention. Other services will include patients requiring long-term rehabilitative care, patients recovering from strokes and orthopedic injuries, and patients requiring end-of-life palliative care. The transfer of these patients for follow-up care will decompress inpatient activity at the OKUH and thereby free up beds to support admissions of patients presenting with critical conditions. Finally, the facility will allow for the provision of dedicated isolation unit for patients with infectious cases. So what is our vision for this hospital? It is our vision to develop the secondary care hospital as one of the few, if only, a digital hospital, providing exceptional care to patients by a dedicated team and support staff. We understand that to become a digital hospital requires 3 foundational elements: an electronic health record system, a process that requires backfile conversion of paper-based records into an electronic format supported by a robust patient administration system, interoperability to enable remote patient monitoring, and connectivity. So we intend to explore and exploit the benefits that information and communications technology can provide for us through telemedicine services, teleradiology, e-prescribing, and of course the whole question of telelaboratory. So that once laboratory investigations are completed and validated, the results are available electronically. Analytic capabilities to generate patient and population health insights. In other words, we want to use data for planning and decision making and for making the best use of our resources. These 3 elements working together can help integrate ambulatory and inpatient care by digitally connecting clinicians across all care sites. Permit me at this stage to clarify this notion of a secondary care hospital. As you know, health systems are developed with 3 levels of care. The first level of care being primary health care. The second level being secondary health care. And the third and more advanced level of care is the tertiary care. The notion of a secondary health care hospital does not mean a lower standard or quality of care, nor does it mean second-class care, nor does it mean care for poor people. It's simply care provided for a different category of patients with different medical conditions in a different setting. So what would our phase 2 works look like towards bringing this facility to completion? In phase 2 of this project development, the full version of the hospital will become more complete and apparent. Works will include complete remediation of the remaining 19 inpatient beds. These would be self-contained rooms with significant upgrades to bathrooms and furnishings, air conditioning, hot and cold water systems, and a patient nurse call feature, to name a few. Private rooms will be available for patients requiring privacy. We'll upgrade and modernize our kitchen operations. We'll undertake minor infrastructural works to our intensive care units. We'll modernize our 2 operating theaters with laminar flow and state-of-the-art medical equipment, including a CM. These theaters will be developed for use by surgeons in the private sector who would like to access a moderately priced, safe, and affordable theater to operate on their patients. These arrangements will be accommodated under admitting privileges currently under review by our board. We anticipate that by April 1st next year, these theaters will be fully commissioned. We intend to establish a virtual ICU to be supported by the intensive care intensivists at the OKUH. We see this as a very important feature in allowing us to provide critical care remotely. And I'm sure we're going to get it right, and when that is done, we'll include St. Jude's as part of that virtualization, so that patients who present in St. Jude's Hospital can be monitored remotely at OKUH and directions given with respect to care. This is how we must enable our system to maximize the limited resources we have and optimize patient care. Finally, and most importantly, the provision of additional nursing resources to support the full development of the hospital is a must. We anticipate that these resources will be provided under the cooperation agreement between the Ministry of Public Health of the Republic of Cuba and the Ministry of Health, Wellness, and Elderly Affairs. We anticipate that works and activities will be completed by the end of the first quarter of 2024. I pause at this stage to recognize a few persons and institutions who have been instrumental in bringing us to this milestone. Firstly, my local management team for working with me in creating a vision for the development of this facility. I single out Mr. Jonathan Emmanuel, who is our officer in charge, Sister Cheryl Edwards, who is here with us today. Where is she? Could you stand so people to see who you are? Come on. Don't be shy. All right. Mr. Emmanuel Dashoville, our security officer. Mrs. Sienna Raymond, who is our support services manager. Where is she? And finally, Miss Daniel Lowy. Is she here? She's in the kitchen. They all know whatever this facility becomes will be of their own effort and resolve. Secondly, Mr. Clive Antoine and his plant and maintenance team for providing project management support and oversight in having these works completed on time. Thank you, Clyde, and thank you, Dania, to your team. Thirdly, to our parent, Ministry of Health, for providing a much-needed seed capital of $5 million to support these capital works and meeting recurrent expenditure. Thank you, US. And finally, to our Board of Directors for supporting the vision as articulated earlier. In closing, ladies and gentlemen, I thank you for taking time off from your busy schedules to attend yet another momentous occasion for the country as a whole and by extension the Millennium Heights Medical Complex. It is our commitment to develop the people-centered model of care across all campuses, including this new addition of the secondary care hospital. The patient experience will and must be second to none. We commit that in the face of unprecedented challenges, that this secondary care hospital will be developed as a model of what a small hospital can be. For those of us who are researchers, we often make the point, smallness allows for completeness. Smallness allows for completeness. One that is complete in all aspects of service delivery expected for such a hospital. One that is efficient with use of ICT as an enabler. One that is focused on the people-centered care, and one that is the best place to work and the best place to receive care. I thank you all for attending this momentous occasion and bid you a good morning. Thank you.
In a very special way, I wish to thank the Holy Spirit for bringing us here safely. But I want to once again apologize to you for being here a little late due to some issues in the south. When I drove on the highway and I looked out the window, I saw everyone sitting there. I said to myself, yes, it looks like healthcare is in good hands. You're on time, you're serious, and you're ready. I wish to recognize the Permanent Secretary, Ms. Jenny Daniel. I also wish to recognize the Deputy Permanent Secretary, Mrs. Inglis, and the rest of the staff of the Ministry of Health, Wellness, and Elderly Affairs. I wish to recognize the chair of the Millennium Heights Medical Complex Board, Ms. Joanna Atherton Reynolds, the Chief Executive Officer, Dr. Dexter James, and the rest of the board, also the rest of the administrative staff, and also the medical staff. I wish to recognize the invited guests, doctors, nurses, other staff members of the Millennium Heights Medical Complex, and also what used to be Victoria Hospital, and then the Respiratory Hospital. One and all, the members of the media, and I see other members of staff outside. One and all, good morning. I'm very pleased to be here this morning to join you and to join the staff in this very important, or on this very important occasion. In the 2023-2024 budget speech, the Prime Minister, Honorable Philip J. Pierre, spoke to the government's plan to transform what used to be the Victoria Hospital into the Castries multipurpose medical facility. Dr. James and the Permanent Secretary spoke at length about the government's plans for this facility. The Victoria Hospital, which became the Respiratory Hospital, will comprise, as you've heard before, the Castries Urban Polyclinic, the Castries Urgent Care Center, and the Millennium Heights Secondary Care Hospital. All of this, all of the developments here point to our roadmap to achieve universal health coverage for St. Lucians. And why do I speak of universal health coverage when we are commissioning the Millennium Heights Secondary Care Hospital? Why do I speak to universal health coverage? It is because our vision and all of our actions will guide us to the attainment of universal health coverage. And every time I speak as Minister for Health, Wellness, and Elderly Affairs, I try my very best to simplify what the government wants to achieve. But I also pay tribute every single time to all those medical professionals, the doctors, the nurses, those individuals who are not medical professionals, but who contributed over the years to this work of trying to achieve some form of universal health coverage program for St. Lucians. There are many views on it. There are many debates about it. How we're going to finance it, what we are going to do, whether the minister knows what he's doing or not. There are so many things that have been said about the attainment of universal health coverage in St. Lucia. And I've said to you before, doctors, nurses, professionals, my mind is a very simple mind. I know that universal health coverage has to do with increasing access to services, to quality services, better quality services to the population, and do it in a way that will prevent them from having further financial hardship. Very simple. And so for me as minister, every single thing we do in the health sector must respond to that. And if what we do does not respond to that very simple definition, then we have to look at things again. So why do I speak about universal health coverage when we are commissioning the secondary care hospital? It is because if we do this well, the Owen King EU Hospital, as Dr. James told you, will feel less pressure at the accident and emergency services. The doctors at the OKEU or St. Jude Hospital or the GIPC, Grizzly Polyclinic, the nurses and the professionals, if we do what we are doing well, we'll feel the effect, the positive effect of these developments. So I want to try every single time to connect the dots, because there are many disjointed activities over the years, and there have been many plans over the years. A lot of them are at the ministry collecting dust, and some of them are beautifully written, very beautifully. Lots of chapters, lots of consultants. But what we do not have enough, I believe, is action. And for me, this today speaks to a positive forward movement for the Millennium Heights Medical Complex. And I want you to give everyone involved a round of applause. For me, if we have this goal of achieving universal health coverage, whether you are in the primary health sector, the health centers, whether you are working at the hospitals or managing the hospitals, or whether you are facilitating tertiary care, if we cannot connect the dots, we have to try to sit down to connect the dots and ensure that these connections lead to better health services, better quality, and reduce financial hardship on our people or those accessing the health care. We can continue to debate about how it's done, but if we debate for decades and decades and decades and we do nothing, then debating is just an academic exercise. I love academia, but I also love action, and this is an example of action. I want, therefore, to take this opportunity to thank Prime Minister Philip J. Pierre and the whole cabinet for their support. For it is in cabinet that we debate those issues and decide whether the Minister for Finance will fund these initiatives. And I want to thank them. I want to thank the Prime Minister and the cabinet, especially the Prime Minister, for envisioning the 2.5% health and security levy. Again, a lot of debate, and that's good. But what I know is that funds out of that, you heard about the $5 million, which Dr. James spoke about. Funds out of the proceeds of the 2.5% levy on health and security will do real things for our health sector. And these funds are doing real things for our health sector. And that is what I like to focus on. We increase the subventions to both the Millennium Heights Medical Complex and the St. Jude Hospital. out of this. And there are several other things that we have done and we will continue to do until the end of the financial year. The vision of the government is to deepen healthcare reform. Deepen healthcare reform. There has been we have had a number of actions over the years, all of which aim to increase healthcare reform and to work on healthcare reform. We believe our mandate forces us to deepen healthcare reform, and we are going to continue to take steps to do this. I am part of a cabinet where the Prime Minister does not want no. He doesn't want to hear no, we can't do this. And my own life has taught me that you do what you can with what you have now. You can dream things for the future. You can dream of so many things. But whatever you have now, do what you can with what you have now. And therefore, every step of the way, I say to the ministry and the doctors and the nurses and so on, yes, we have problems in the healthcare sector in St. Lucia, but we also have so many successes. We have so many professionals who work in so many places around the world. They are called to consult on so many important and so many complicated issues around the world. And therefore, let us not believe that everything in the healthcare sector is a big problem. We have the people in St. Lucia, the professionals who can help us solve our problems. So let us do what we can with what we have. I wish to say to you, on behalf of the government, I wish to thank all those from the Ministry of Health, private sector, and from the Millennium Heights Medical Complex who participated in this endeavor. I wish to thank all those who contributed to the development of the Victoria Hospital, the respiratory hospital, the medical directors, Dr. Eugene and Dr. Charles, and so many others whom I don't know of, but I know that so many of you, the nurses, the administrative staff, so many of you contributed to this Victoria Respiratory Hospital, which we are now beginning to transform. I wish to thank you for your services, Dr. Belma George, the CMO, and all of you, all the doctors, Dr. Joseph, everybody here who contributed, and those who are not here, on behalf of the government, I wish to thank you. I wish to say to you, we understand your sacrifice, and we know that there are challenges. But what is this all about? This is about better care. This is about quality care. This is about converting every single health facility in St. Lucia to a center of excellence. And even though we do not name it as a center of excellence, every single health facility should become a center of excellence, where not only St. Lucians look forward to coming to this place, but people from around the Caribbean and people from anywhere, someone from anywhere in the world can point to the Millennium Heights Medical Complex or to the Castries Urban Polyclinic and say, I want to come here and I want my family to be here because that's the best in the world. And Dr. James said it well. We are small, but we are not insignificant. There are things we can do. We have done it in literature. We have done it in the arts. We have done it in economics. We have done it in medicine. And there are things we can do here at this facility which can cause us to shine a light in the world. And I want to encourage you to be that light. Continue to be that shining example. Dr. James spoke about the future, being a digital hospital, telemedicine, and so on. But as many of you know, that future is already here. We are already using facets of digital medicine and telemedicine, whether it be at the OKEU, the St. Jude Hospital, with their dental work and so on. And many doctors in St. Lucia, in collaboration with other doctors throughout the region, are already practicing telemedicine. We want to institutionalize it and make it, bring the future. The future is already here, and I want to encourage you to continue to push towards that future. Just a few days ago, we were in Martinique, and Dr. James was with us, and we saw what's happening at the University Hospital in Martinique. And as you know, the Millennium Heights Medical Complex, in particular the Owen King European Union Hospital, they are working with the University Hospital in Martinique. There's been a very long relationship with Victoria Hospital and so on. I've asked that we include St. Jude Hospital in that relationship in a more formal way so that we can advance what we're doing. We know what we need to do. We know what we need to do. We have the skills to do it. We have the administrators, we have the medical staff, we have the professionals. Let us believe in ourselves. Let us continue to do what we are doing to put our people first. And everything that we do will focus on universal health coverage and putting people first. In this case, putting our patients first. In this case, putting the staff, putting all those whom we interact with first. Let us have the best healthcare experience for our people. Too many people complain about not receiving the care that they deserve to receive, and we are not going to talk about payments and all of those kinds of things. We know there are issues. We know that the people themselves need to invest even more in our own personal healthcare without only blaming the doctors and the hospitals all the time. We know that. We know that some of us access the healthcare facilities knowing full well that we've abused our own bodies and our own minds. So we know there's a responsibility that the individuals must take. But when we interface with the healthcare facilities, those of us within the healthcare sector, let us do the best that we can within our experience, knowledge, and resources to give our people the best healthcare service that we can give. The whole issue of responsibility and accountability, very, very important. Ethics, and all those things you know about. Let us use them to do the best that we can. As I end, what can I say to you? I'm a politician, and the Prime Minister says all the time, we have a shelf life. My shelf life is already half time, 2.5 years. Gone. And so I don't claim to fight for any prize in politics. All I want to know is that we took something, a project, the ministry, the health services, from where we found it, and we improve it by leaps and bounds. That's what I care about. That we ensure that our staff gets further training, better opportunities, that we do what we have to do to keep our wonderful nurses who are going out to greener pastures, and the doctors, that we try to create, even though the pasture is not as large as it is over there, but try to create some small lawns for them that are greener than over there in some ways so that we keep them. That we try our best to put our patients first, and that things are better than they were before, and that we can measure them. So many times people tell me, Minister, you know we're doing that better than it was before, and so on. I say, really? Give me the performance indicators. Give me the figures. Tell me how many ambulances we had in 2021 and how many we have now. Tell me how many more nurses. Tell me, how did you change the processes at the health centers? Are the patients seeing the doctor in a better environment? Is the office better? Did we give the doctors a better chair, or the nurses? Those chairs that have been torn for years, or the doors that are not locking. Very simple things. Are we making people feel better about themselves? Do we have a better work environment? Are we employing welfare officers who speak to the patients when they come to accident and emergency, and they can't see the doctor yet, and everybody vexed because they can't understand why they can't see the doctor yet? But there are good reasons. But is there someone talking to them and just saying, ma'am, just hold on a little while. I know you have this issue, but we will try our best. And can we measure them? I see the OKEU with the surveys. And how do we measure those things? And so that when I speak in Parliament, I don't want to feel like a papi show. I don't want when I speak for the doctors to say, what that minister talking about? He don't know what he's talking about. Or the nurses say, but what's that minister talking about? I want to have documented evidence. And here we have documented evidence. In August of 2022, general discussion started. By budget of 2023, funds allocated. In December of 2023, we are commissioning. That is excellence. Give yourselves another round of applause. We spoke about the oxygen plant for years, 2016, 2015, oxygen plant. We spoke about it, and there are definite steps. There were definite steps. We have commissioned it. The laundry, another set of soaps. This and that, and soaps, and this, and endless reports, and so on. I believe in reports, But trust me, the PS can tell you, and the CMO and those who work with me. I believe in reports. Give me reports, give me speeches. I listen to them, but then I ask, where's the plan for action? When are we doing this? When are we doing that? If we have the money, how come we are not doing it yet? And I want to thank them and Dr. James and the rest of you for helping to push these things forward. Some of you will know that there is actually a cabinet conclusion from 2013. And I have it. The government back then, in 2013, agreed that the Victoria Hospital, after the shift to OKEU, that the Victoria Hospital will be transformed into an urban polyclinic, that the health center in Castries was not fit and we had to move things. 2013. It is now 2023. And forget COVID. So what we have to do as I take my seat, is to take these things, those decisions, and our professionalism and our commitment to getting things done and doing it like you're doing it. At the St. Jude Hospital, we are pushing in the very same way. They are working hard to ensure that they deliver on the targets and on the goals. Because at the end of the day, it is for people we are doing it. St. Lucians, and we're doing it for ourselves, because we will face the health sector, whether you like it or not. If you have the money to take a helicopter or a private plane out of St. Lucia, God forbid, but you may have to be stabilized. That's what the doctors tell me. You may have to be stabilized even before you can take your private plane and go to Miami or wherever you think you can go. So the health sector in St. Lucia is important for all of us to ensure that our people get the best service. So thank you and congratulations to all those who worked on this project, all those who conceived it, who worked on it, the doctors, the board of directors, every single one of you who worked hard. And I look forward to the continued implementation of this project here at Victoria Hospital. And I'll give you one assignment before I go. And this is for everybody, the Ministry of Health. I've been dreaming of that kind of thing. Do you know that Victoria Hospital, this site, is one of the most valuable sites in the world? Did you know that? When you look at the history of Victoria Hospital, what it means, what it meant for the war and for the Caribbean, I want us to work on a project. We are going to turn this place into a very important historic site. We're going to do that. I want you, those of you who have those kinds of ideas, speak to the PS, get a team together. PS, she has those kinds of ideas too. Let's find a way to turn the Victoria, whatever we call it, I don't know what we'll call it. But this is an historic site. And all of the developments over the years, the doctors and the nurses who passed through here and their contributions to St. Lucia, the Caribbean, and the world. And I'm not talking about for tourism, people who come from overseas, Primarily for St. Lucians. The children of St. Lucia to come here and learn. You put a kiosk, interpretation center, where whatever you do, tell them about the major operations that happen there and who saved whose life and what happened there and the Castries fire and all those things. Beautiful. Let us not allow this place just to be a hospital on the hill, and people are passing, they don't know the history of this place. I challenge you. And again, PS will determine who's on that team or whatever. I challenge you during next year to come up with a plan to turn this place into a tourist attraction. And again, I repeat, when I say tourist attraction, I'm not talking about only people from overseas, from the cruise ship and so on. Local tourism, education, and let's do it. We have 2 years. Let's do it, please. Okay? So thank you very much, and congratulations, one and all.
Honorable Minister, you said the future is here. Well, it is. Welcome to the secondary care hospital and one of the most advanced technological sites that you will see and continue to see. So we're starting to make history, as every patient will have this tablet where they can order meals, learn about the hospital, and get information, news, health pieces, all from the power of their hands, and connect with our medical team.